collimation. So,
You said it's the same as the lateral ankle?
same as lateral ankle. So, Shamika, I'm going to have you turn just slightly towards me. Bring your leg to the side. Good. Slight bend on your knee. Very good. Go down on top. Okay. So just bend your knee slightly. Here we go. All right. Once again, I have my IR following the long axis of my leg here. Once again, I'm going to just turn this to follow. Okay. Now, for the ankle, where did I center?
At the malleolus.
Right, centered right here at the malleolus. For the lateral calcaneus, I'm going to go 1 inch distal below the malleolus. So just this way. I'm going to center right here. Right, so once again, we're going to have our dorsiflexion. So, here you go. Once again, I'm going to lift up this knee. Good. Lift up. Keep that foot against the board here. Right. So did you notice that when she was lifting up, this part of the foot was lifting up as well?
Mm-hmm.
Right. So just be careful. Some patients will be like that. Make sure you turn it back down so it's flush against the board here. All right. Very good. You can bring your knee down just slightly. Very good. Work like that. Nice dorsiflexion. And now malleolus 1 inch down. So I want to be right about here. So I'm going to pull your foot just this way a tiny bit. There you go. All right. Malleolus 1 inch. And now we collimate. For this, because we're interested in the calcaneus, we can afford to collimate much tighter. But once again, make sure you keep catching the malleolus on your calcaneus, right? You don't want to go so tight that you lose it. So keep that ankle joint, keep that malleolus. All right, here, where can I put the marker? I have a little bit of corner of light here, so I can try and squeeze the marker here. Sometimes this corner is going to be too small, so in that case, I'll actually put it behind the patient.
Medially? Or is that just posterior?
Posterior.
Okay.
Normally, we like to mark our laterals anterior, right? But sometimes we don't have room, so in that case, posterior. All right. So, lateral calcaneus, any questions?
Okay, 2 inches below.
Can you hit the light again? Sorry, Emily. Okay.
Is it possible? People break that?
Calcaneus? Mhm.
Oh, Jesus.
I mean, it's the heel bone, so just laying too hard on the heel, you can fracture that.
It looks so big though. I mean, doesn't seem as easy.
Yes, not as easy to break, but still breakable. All right, go ahead and relax your leg for now.
They put pins in it for foot and ankle reconstruction.
Come on your back again, please.
You see my ashy scar?
No, actually did not.
Yeah, I don't see what you're talking about.
Huh?
I don't see what you're talking about.
Good.
We're doing tib fib now?
Yes, so now let's talk about tib fib. You can leave your leg back for now. Tib fib, long bone, right? 14 by 17, long cassette, right? Definitely do not do a tib fib on a 10 by 12. Unless it's a PD, right? PDs, maybe. So, keep your leg straight. I just wanted to take a look here. Here is the top of the tib fib, right where the knee is. Here is the ankle, the bottom of the tib fib. Look at, does it fit on the IR? Really close, right? Really close.
So we're just gonna turn
But
it?
do I have enough? I want to leave space beyond the joints. I don't have enough space on my IR to get both the tib fib and space beyond the joints. At least not like this. So there are two things that you could do. Number one, I saw the two of you already begin to hint at it. What can I do with my IR?
Just ankle it.
Right, instead of going this way, we can angle it this way. Great. Is that what you see in clinic?
No.
Sometimes, yeah.
Sometimes. But what do you see more often?
Two,
Lower.
two.
Right. We do one here, and then we do one here.
Yeah.
Is that called image stitching, or is that just?
Mm-mm.
They just send
So
two.
you just send two images.
Okay.
Stitching the images would actually be merged into a single image.
Okay.
Right. So in that case, you just do your upper 2 inches, top of the cassette 2 inches above the knee, right? Bottom one, you do it just like an ankle. Or you could do it vice versa, no problem. This bottom 2 inches beyond the ankle, top, do it just like a knee. Either way, doesn't matter. Okay. So, let's try the diagonal method. All right, lift up your leg, please, Shamika. All right. Okay, back down. Good, and turn. There we go.
For people who have long legs and then just, you already know it's not gonna fit, two is just.
Right, so if you had me for a patient, for example, right, probably just go straight to 2. Let me just make sure I'm centered. Ooh, close. Just gonna move your ankle a tiny bit towards the middle. There you go. All right, great. So if we take a look here, I am in the middle of my tibia. I have my knee joint up here, I have my ankle joint down here. I have light past here, I have light past here. And then I just collimate in sideways like this to still catch the soft tissue on both sides. I'm not collimating off my soft tissue. Make sense? All right, marker, lateral side, AP tib fib. Any questions? Notice, what do you see here on the table?
Some light field.
Some light field. I have light field outside my cassette. I've always said that you should not have light field outside your cassette. Is this acceptable?
You can't really do anything about it unless you rotate the tube head.
Right, so in this situation, it is okay because my tube and my IR are no longer traveling in the same direction, right? My tube is like this, my IR is like that. That's why you've got these corners of light. Should I turn my tube to get rid of the corners of light? Well, what happens?
It changes it. Yeah.
Right, it doesn't make sense. I want to follow my anatomy with the tube. Right, so, no, this is fine. No problem with this.
Okay.
Okay, very good. For the lateral, we can do the exact same thing. So, Shamika, if you would turn
Do you want to keep
to
recording
face
this?
me, please.
Huh?
So turn to face me.
I'm chilling.
Good, right there. So you don't need to turn all the way, just a little bit. Great.
It's your phone,
And
so,
so,
I'll respect
yeah.
your if you want your phone back.
Great. Okay, once again, try and dorsiflex.
So you lined up
I'm just gonna
the
slide you forward.
lasers and shadows to make sure that you were centered to the IR first?
Correct. So I do my alignment this way first, right? Center, center, and then I rotate to follow my leg.
Okay.
Because the center will not change. All right. Right marker anterior, coming straight down the center of the tibia. Right. And so this is gonna be my lateral tip fib.
Okay.
All good?
Mhm.
Okay, very good. Thank you, Shamika. Let me take this off you.